Welcome to Emergency Insights. I'm your host, James Carter. Today we're discussing how to prevent awareness during paralysis in septic patients. This is a high-stakes scenario we've all encountered, and it demands a thoughtful, evidence-based approach to ensure patient safety and comfort. Imagine this. A 55-year-old man presents with fever, hypotension, increased work of breathing, and an altered level of consciousness. Classic signs of severe sepsis requiring immediate airway management. While intubation is often life-saving, there's a concerning statistic we can't ignore. Up to 3% of emergency department patients may experience awareness during paralysis. This can be a traumatic experience, and as healthcare providers, it's our responsibility to prevent it. Let's start by addressing the rocuronium conundrum. Rocuronium has become the preferred muscle relaxing for many ED physicians due to its favorable safety profile. However, recent research highlights some troubling patterns. Patients receiving rocuronium compared to succinylcholine are less likely to receive adequate sedation, experience delays in sedation administration, and even longer delays in analgesia administration. What's particularly concerning is that hypotensive patients, our most unstable cases, are even less likely to receive the sedation they need. This creates a dangerous paradox. The patients who are most vulnerable are at the highest risk for awareness during paralysis. So, how do we address this? The solution starts before we ever place the laryngoscope. Preparation is key. Before intubation, ensure that post-intubation sedation and analgesia medications are drawn up, labeled, and ready at the bedside. This is especially critical for patients receiving rocuronium, who are more likely to face delays in medication administration. By having everything prepared in advance, we can act swiftly and reduce the risk of awareness. Another essential strategy is bridging the gap. Once the endotracheal tube is secured, administer a small dose of a rapid-acting sedative, like ketamine. This creates a bridge until your sedation infusions are fully running, helping to prevent the rare but devastating complication of awareness during paralysis. Think of it as a safety net during those critical moments. Finally, don't wait to optimize hemodynamics, especially in hypotensive patients. Initiate vasopressors early, either prior or during the intubation procedure. Proper hemodynamic optimization not only improves patient outcomes, but also ensures that sedatives and analgesics can be administered safely and effectively. Remember, soft blood pressures should never delay the necessary steps to keep your patient comfortable and stable. In conclusion, preventing awareness during paralysis in septic patients requires deliberate preparation, thoughtful medication selection, and timely interventions. By anticipating the challenges of rocuronium paralysis, preparing medications in advance, bridging the sedation gap, and optimizing hemodynamics, we can minimize this complication and provide the highest quality care to our most vulnerable patients. As emergency medicine providers, it's not just about what we do, it's about how and when we do it. The seconds between securing the airway and administering sedation can make all the difference in preventing patient awareness and subsequent trauma. That's all the time we have for today. Thank you for listening, and we'll see you next time.